Welcome to TIMFD. Today is my favorite day with your hosts, David Towner and Sam McEwen. If this podcast does speak to you, please like, share, and comment. Let your friends know all about us. And now, here's your hosts, Dave and Sam. Well, good afternoon. You'll notice I'm here by myself today. Dave is taking some time off, and there's some things that you'll hear about in the upcoming episodes and weeks and months as we go by, but his daughter passed away a little while ago. There will be a link in this episode to her service, and there's where you can get all the information about her death and the celebration of life that we had for her and what is going on. But today I wanted to talk about an issue that arose out of Rebekah's life and her death. One thing I will say right away is we know that Rebekah was saved. We know that even though she struggled here on earth, she's dancing with Jesus today. So always keep that in mind. Your salvation is through Christ Jesus. I'm going to be giving you some information today. It could be a little tedious, but I encourage you to listen. It's vital information, and we really need to understand what's going on in our country with mental illness, with mental health issues, and some of the things that we need to do to help folks who are struggling. The information that I've come up with contains information from studies by organizations like Substance Abuse and Mental Health Services Administration, Centers for Disease Control and Prevention, and the U.S. Department of Justice. There's different terminology, and there's terms like serious mental illness, and mental health disorders may seem like they're referring to the same thing, but in fact, they are not. They refer to specific diagnostic groups for that particular study. If you have any questions on the statistics, I will post a link to the article so that you can jump on the links and see what's there and get the information firsthand for yourself. But here's some just disturbing things when you stop and think about it. 1 in 5 U.S. adults, remember this is just the United States, it's not worldwide, but 1 in 5 U.S. adults experience a mental illness each year. 1 in 20 U.S. adults experience serious mental illness each year. 1 in 6 U.S. youth, look at this, 6 to 17 years old, 1 in 6 experience a mental health disorder each year. 50% of all lifetime mental illnesses begin between the age of 14, or by the age of 14, and 75% by the age of 24. That 14 to 24-year-old range is so crucial to diagnose and to begin to help folks who are struggling with mental illness. Most of us know this fact, but suicide is the second leading cause of death among people aged 10 to 34. Second leading cause of death. When it comes to mental health issues, you're not alone. Trust me, you're not alone. 21% of U.S. adults experienced mental health illness in 2020. That's 52.9 million people. 1 in 5. 5.6% of U.S. adults experienced a serious mental illness in 2020. 14.2 million. 1 in 20 adults. 16.5% of U.S. youth aged 6 to 17 experienced a mental health disorder in 2020. 7.7 million young adults. 7.7 million. 6.7% of U.S. adults experienced a co-occurring substance use disorder and mental illness in 2020. The substance abuse and the mental illnesses, they do go hand in hand. That's 17 million people, folks, in 2020 alone. 17 million. I have some breakdowns on ethnic groups and things like that, and I'll get into some of them. Remember, these are not my numbers, and I am not meaning to point out any one age range or ethnic group, but here are the breakdowns. Non-Hispanic Asians, 13.9. Non-Hispanic whites, 22.6% of folks experience mental illness. Non-Hispanic Black or African American, 17.3. Non-Hispanic American Indian or Alaskan Native, 18.7. Non-Hispanic Mixed Multiracial, 35.8. 35.8. Non-Hispanic Native Hawaiian or other Pacific Islanders, 16.6. Hispanic or Latino, 18.4. And then the lesbian, gay, or bisexual community, 47.4% is the prevalence of mental illness in that demographic group. There's various things that we can break out, some major depressive episodes and schizophrenia, things like that. I'll give you some real quick references. I'm not a mental health expert, but I can tell you if you look this up, when you click on the links in the article, you'll see what I'm saying. But major depressive episodes, 8.4%, 21 million people. Schizophrenia, 1.5 million people suffer with it. Bipolar disorder, 7 million people, 2.8% of the entire population. Anxiety, come on. We all have some sort of anxiety from time to time, 19.1%. But these are folks who are dealing with it every day and struggling with it. Post-traumatic stress disorder, and this is huge amongst our militaries and folks who have been in conflicts or who have been on the front lines in any, our first responders and things like that, 3.6%. OCD, obsessive compulsive disorder, 1.2%, about 3 million people. Borderline personality disorders, 1.4%. Now, you have to take a look at these numbers in context. These are not estimates. These are based on folks who have been diagnosed or who have actually gone for help. This is not an estimate. This is actual diagnosis. So what percentage of the population that's suffering from a mental disorder is not even going and seeking help? Some of the mental health care matters. There's some concerns about the care that our folks who have mental health issues, diseases, compulsions, about the care that they're getting. Only about 46.2% of U.S. adults with mental illness received treatment in 2020. It's not even half. 64.5% of U.S. adults with serious mental illness received treatment. Now you got to stop and think about that. At some point in time, people with a mental illness will probably pop over into the serious mental illness if they haven't gotten help. 65%, almost 65% received help with a serious mental illness. 50.6% of U.S. youth aged 6 to 17 with mental health disorders received treatment in 2020. That's not enough. We're not recognizing the mental health issues and disorders in our young people. We're not listening to what they're saying. And by we, I mean society, adults, pastors, teachers. We're all so concerned about pushing an agenda and pushing stuff on folks that we don't pay attention to what's going on with our young people. Now, I don't want to sound like I'm preaching at you or lecturing you or anything else. These numbers just astounded me. And I'm going to make no apologies for as hard as this seems. This is something we need to take a hold of. If you are listening to this and you've gotten this far, we're not even quite halfway through, then you understand that this is a serious issue and this is something that we need to deal with. And there are things you can do to help. And at the end of this, we'll get into that. One of the problems that we have is that folks don't go and look for help. Let me give you some real quick numbers by demographics. The treatment rates between males is 37.4, females 51.2. The women are smarter than we are, guys. They're getting help, okay? Lesbian, gay, and bisexual, 54% are seeking help. Non-Hispanic Asians, 20%. Non-Hispanic white, 51%. Non-Hispanic, Black, or African American, 37%. Non-Hispanic, mixed, multiracial, 43%. Hispanic or Latino, 35%. We have to bring those numbers up. We have to make mental health a priority, and we have to make it accessible to all ages, ethnic groups, background. Doesn't matter. Doesn't matter if you're a white male. Doesn't matter if you're gay or lesbian or bi. That doesn't matter. The help needs to be there. Here's a frightening fact. Only 11% of adults with mental illness, 11% of adults, they had no insurance. 11%. 11% with serious mental illness had no insurance. So what are we going to do about it? I'm not talking about socialized medicine or anything else, but what are we going to do about getting help for somebody who has no insurance? There's organizations out there, there's things out there that can be done. And so we need to begin to, as a community, come together and see that folks can get help, and it's not going to cost them an arm and a leg. Medical expenses are so outrageous. I got a bill for an office visit, okay? An office visit for a family member. Our copay was $40. Do you know what they billed insurance for an office visit? This is a 15-minute office visit. $320 for a 15-minute office visit. We paid our copay, and our insurance picked up the rest. Something has to be done about that cost, and something has to be done about the cost of treatment for mental illnesses. There's about 150 million people that live in designated mental health professional shortage areas. We really have to help with that. There are a lot of ripple effects when it comes to mental health issues, and it can be a snowball effect. It can move from a ripple effect to a tidal wave real quickly. And just real quick, but people with depression have 40% higher risk of developing cardiovascular, metabolic diseases than the general population. Think about that. If we treat the depression, the risk of heart disease, metabolic diseases goes down substantially. Therefore, the cost of healthcare goes down substantially. 32% of U.S. adults with mental illnesses also experience substance abuse disorders. It's going to snowball. Substance abuse eventually leads to jail time. Eventually, it just does. It's a snowball effect. The rate of unemployment with folks who have mental illness is 6.4% as opposed to 5.1%. There's some very high functioning folks with mental illness, mental disorders that are in the workplace every day, but they struggle. They struggle with either alcohol, drugs, bipolar. They struggle, but they show up. And we're not recognizing the symptoms. At least 8.4 million people in the U.S. provide care to an adult with mental or emotional health issues. Get this one. Caregivers of adults with mental or emotional health issues spend an average of 32 hours per week providing unpaid care. 32 hours, that's a full-time job. And it is. It is a full-time job. If you have family members who have mental illnesses, if you have Alzheimer's is just, it's snowballing across the country. They have no idea how to cure it. They have no idea how to treat it. I just read an article that they signed a bill allowing payment for an Alzheimer's drug, but they'll only pay for the Alzheimer's drug if you're in the study of the drug, because the drug is not generally approved yet. I don't see the sensibility in that. We need more help for the caregivers while we work on the cause and the cure. They still don't know. They still don't know. They can do tests to say how many of the markers you have for Alzheimer's. I have 2. There's 4. But you could have no markers and get Alzheimer's. You could have all 4 markers and get Alzheimer's. You could all 4 markers and never get Alzheimer's or dementia. They just don't know. Here's something on the other side of our healthcare expenses. Mental illness and substance abuse disorders are involved in 1 of every 8 emergency department visits by U.S. adults, an estimated 12 million visits. That's a lot of emergency room visits. I have a daughter who works emergency room, and she's a coordinator. I don't know what her title is. I honestly don't, because her main study was radiology, but she coordinates. Anyway, she can attest to this. And it's the communities we talked about earlier that are coming into the emergency rooms with substance abuse, mental health orders, and quite frankly, clogging up the emergency rooms and costing them a fortune. But yet, what is it, 11% don't even have insurance. Mood disorders are the most common cause of hospitalization for all people in the U.S. under age 45. That's astounding, just astounding to me. Think about how it affects the economy. Serious mental illness causes $193.2 billion, that's with a B, in lost earnings each year. That means people take time off, they don't get paid, bills go unpaid, mortgage doesn't get paid. 20.8% of people experiencing homelessness have a serious mental health condition. You want to clean out the prisons, you want to take the population down, you want to help out that situation. 37% of adults incarcerated in state and federal prison systems have a diagnosed mental illness. Diagnosed. So what's the percentage of folks who are actually in the penal system that actually have mental illness? It could be much higher. I can tell you that once a person is incarcerated, unless they act out, they become violent or anything like that, the prison's not going to check to see if they have mental health disorders, right? They're just not going to do it. Here's one for you with our kids. 70% of youth in juvenile justice system have a diagnosable mental health condition. 7 out of 10, 70%. That's where we need to begin to really help our young adults out before it becomes full-blown and they get in trouble. 15.3% of U.S. veterans experienced a mental illness in 2019. That's 31.3 million people. And we know that the suicide rate amongst veterans is something like 20%. It's insane. It's insane. Depression and anxiety orders cost the global economy now $1 trillion with a T in lost productivity each year. Depression is the leading cause of disability worldwide. One of the things that we have a tendency to not talk about is suicide. Suicide is the second leading cause of death among people 10 to 34. That has to stop, and it's due to mental illness. Suicide is the 10th leading cause of death in the United States. The overall suicide rate in the U.S. has increased by 35% since the turn of the century. 22 years. 35%. 46%, almost half of the people who die by suicide had a diagnosed mental health condition. Here's one that will really wake you up. 90% of people who die by suicide had shown symptoms of a mental health condition, according to interviews with family, friends, and medical professionals. It's also known as a psychological autopsy. We have to stop. We have to stop. We need to begin to pay attention. Now, I'm not telling you to go run and turn your neighbor in or turn your kids in or turn your mom and dad in or anything like that, but we really need to get a handle on the suicide rate in this country. And here's the thing. If you or someone you know is in an emergency and you need to call the National Suicide Prevention Line, call it. It's 1-800-273-TALK, 1-800-273-8255, or call 911. They'll get somebody there. Don't try to handle it on yourself. But we need to pay attention to what's going on. So in summary, 1 in 15 adults experience both a substance use disorder and mental illness. 1 in 15. Among U.S. adults who did receive mental health services, 17.7 million experienced delays or cancellation in appointments. 7.3 million experienced delays in getting prescriptions. 4.9 million were unable to access needed care. One of the statistics that really was kind of frustrating to me is that 26.3 million U.S. adults received virtual mental health services in the past year. 50% of those had serious mental illness. How can you deal with that over Zoom? I'm really concerned about our young adults, our young people, ages 10 to 17. 1 in 6 experienced a major depressive episode. 3 million had serious thoughts of suicide. 1 in 5 young people report that the pandemic had a significant negative impact on their mental health. And there's a whole bunch more. I haven't even begun to get into the criminal justice system. One of the things that really needs to change is access to care. 3 in 5 people, 63% with a history of mental illness, did not receive mental health treatment while incarcerated in state and federal prisons. Less than half people, 45%, with a history of mental illness received mental health treatment while held in local jails. People who have health care coverage upon release from incarceration are more likely to engage in services for mental health that reduces recidivism. That is, I can't say that word, recidivism. That's, they're repeat offenders and they go back to jail. Mental health related issues are prevalent in our society. One of the things that we are planning on doing, that Dave, when he gets back, he'll have more information on that, but we are going to start a fund here at the church and a process in honor of Rebekah Towner for seeking mental health care. I don't know the full scope of that yet. We don't have everything lined out. We have a lot of people who want to help because it is a raging epidemic. It is a pandemic. I will put the links here, and I'll put the links for Dave if you want to reach out to him or to me about the upcoming initiative, mental health initiative, with your questions. We are getting ready to set up a fund for you to donate to, so please reach out. If you notice somebody who is struggling with their mental health, please do the right thing. Do the right thing and get them help. Talk to them. Don't try to talk them off the ledge. Don't try to diagnose. Don't try to do those things. Don't, by all means, don't judge, but get them the help that they need. If you have to walk them to the doctor's office, get them the help they need. Our topic is mental health today on Today Is My Favorite Day. And there's a lot of stories that I could share around this, but I'm running out of time. I want you to remember that if we continue to gaze at God and glance at our problems, we can help this mental health issue be reduced. If we can get our focus where it needs to be, we will be able to combat mental health efficiently. This has been Sam McEwen. Live intentionally. Be very, very blessed, my friends. Thank you for listening to TIMFD. Today is my favorite day. The views, comments, and opinions expressed here today are those of the hosts and guests alone, and Dave and Sam are solely responsible for the content of this podcast. TIMFD, Today is My Favorite Day, is produced and directed by Alex Korn. Music is composed and performed by Chuck Vaught. Thank you for listening. Have a great day, live intentionally, and be very blessed, my friends.